So expanding on insurance, there's a couple areas to look at. So first, why? We've talked about how you have an average healthcare cost per person of roughly $10,000 in this country. Okay, roughly 10,000, and it's like 9,990 in 2015. So why do we have it? So you might think to yourself, okay, well, $10,000, I can save that up. Okay, or I'm really not that sick, or I don't really go to the doctor that much. But when it comes down to it, a lot of it has to do with spending. So this is a little bit outdated. I believe this is actually 2010, but the same principle applies. So if we look here, if you ordered all the healthcare expenditure by person from smallest to largest, okay, the bottom 50%, so if you took the bottom 50 percentile of all healthcare expenses, all right, which is 155 million people as of 2010, it's about $541 per person on average. So the average of half the population with the lowest cost is $541. Well, now let's go from the 50th to the 90th percentile. All right, so you go to the upper middle 40%. The average there is 6,810. Okay, now again, this is as of 2010. So you might say, and as of 2010 at least, the average was $8,459. So you might look at that and say, well, wait a second. $8,500 is the average, and if I'm in this 90 percentile, I'm in the group that either has a $6,800 average or a $541 average. I can do that. I can save. I'm not affected by that. Okay. Well, the reason why people have insurance is because of these next groups. This other group, the next 9%, so the 90th to the 99th percentile, their average is $39,850. And if you go up to that top 1%, $187,000 and change. Right? So these are significant. The reason why people have insurance is because they see these possibilities of these very high costs, and it scares them. Okay? It's that $40,000 or $190,000 can be financially debilitating. It can really, really set you back. And so people want to protect against this. Even if most people in this category are more on the elderly side, okay, there's still people in there who get in accidents, or who are young and get sick, or have cancer, or some other serious disease that can be very expensive. So all of this is really factored in, and it's people get insurance to prevent against that. And if you look at it here, you can see this distribution is very heavily skewed, and so you want to stay out of this group here. Okay. So these transactions with the insurance company, variability. The other thing to note is that when it comes to insurance companies want a lot of people covered under their plans. So let's go back to our example here with the ping pong balls. So in the ping pong ball example, we knew with certainty that 1 out of 100, all right, was going to pull out the ping pong ball. All right, so their expected value is 100. Their expected value is 100. And so everyone paid a premium of $100. So the insurance company collected $10,000. And what happens is, when the person pulls out the ping pong ball, they have to give that person 10,000. So in this case, one person pulled it out. All right, they had to pay out 10,000, And so as we can see over here, they collected 10,000, they paid 10,000, so they have nothing left. In reality, however, we don't know with certainty how much people are going to, or, when we talk about health, we don't know how often people are going to get sick. We don't know if everyone's going to have a 1% chance of getting sick. So let's say that instead of the ping pong ball, this is actually people getting sick. Everyone has roughly a 1% chance of getting sick, okay? But the insurance company comes in, and it's possible that 2 could. All right, you expect 1% to, 1 out of that 100 to do it. But let's say then that the insurance company comes in, they cover these 100 people, and 2 get sick. All right, so 2 of them get sick, and they have a $10,000 medical bill. Now, the insurance company, their agreement was they would pay the person if they got sick. And so they paid $10,000 to the first person, $10,000 to the second one. So now they're down $10,000. And that's very possible. All right. If everyone has a 1% chance, it's possible that 2 out of 100 could have. It's also possible that none could have, in which case they collected 10,000, they paid 0, and so they made 10,000 profit. Okay. But what's going to happen is as they cover more people, right? So instead of covering 100, they cover 200. All right. It's more likely that out of those 200, 2 will get sick than it would with 100 that 1 would. Okay. Or sorry, let me rephrase it. There's less variability within that with the larger amount. And so let's say we have, instead of 100 people, we have 1 million people. And in that group of 1 million people, there may be one group of 100 that has 1 person get sick. And another group of 100, there might be 3. And another group of 100, there might be 5. Another group of 100 might be 0, and then 0, and so forth. What's going to happen, though, is as you average out all those different groups and the pool overall, all right, there's going to be a smaller chance that you're going to have those cases where you have to pay out a lot or none. And so what that looks like is, it's called the central limit theorem, with basically the higher the amount, all right, the lower the what's called confidence interval. And so the confidence interval basically says, and I apologize for butchering the statistics here, if it's a 99% confidence interval, it says that if you pull a group out of there, 99% of the time, the value is going to be between or within that interval. So here, if the expected loss is 500, if the number of people in the risk pool was 200, you can see that 99% of the time, okay, it's going to be in that band. So as high as 1,400, 1,300. But if you have 20,000, you can see that the interval of that you can say with 99% confidence, it gets smaller and smaller. So when we talk about the third-party transactions, we talked about that a little bit back in chapter 1. But with insurance, you have those 3 parties. It's not just the 2-party transaction between the patients and the doctors. And in fact, that money there, that's only 11% out of pocket. Where most of it is coming from is through the insurance companies, through the government. So patients and the public pay premiums and taxes into these insurance pools, and they pay via reimbursement the hospitals. Now, when we talk about fair versus actual premiums, over here you have the actual premiums, and the fair portion of it is basically what's over here. And as far as this idea of who pays and how much, the insurance companies, the governments, they never actually pay. Right? They're, in essence, they are financial intermediaries. Right? They collect money and they pay it out. Okay, and that's what they do. Now, having said that, benefits are complicated. And when it comes down to insurance, you get what you pay for. So basically, if you want a low cost plan, that plan is not going to cost a lot. If you want a high cost plan, right? Or sorry, if you want a high benefit plan where you get a lot, you have to pay more for it. So you're literally getting what you pay for, right? Because and it all comes back to this idea of fair versus actual premium. Okay? If you want a plan that's charging you where the fair premium is low, right? It's low because they're not paying out as much. If, however, you have a plan that has a high premium, okay, it's high because they pay out more. The benefits are better. So it's really the case there, again, where you are literally getting what you pay for.